Hello everybody, I'm going to be discussing bicuspid aortic valve disease today. So a little bit about the disease background. It is the most common cardiac congenital anomaly. There's a 3-to-1 male predominance with this. It's responsible for more deaths and complications than all other congenital heart defects combined. Bicuspid aortic valve disease can also occur due to age when there's calcium buildup on the valves, and then this causes those valves to become stenotic. So a little bit about the pathology of the disease. It's usually the aortic valve is a tricuspid valve in a normal heart. So in the bicuspid aortic valve, or in bicuspid aortic valve disease, there are only 2 leaflets due to the fusion of the adjacent aortic cusps. So if we look at this diagram, you can see that this is a normal tricuspid valve, and then this is the abnormal bicuspid valve, and if you can see, the valve doesn't close all the way or completely. So what happens is it causes a regurgitation of blood flow back into the left ventricle, and then it causes some issues with the heart. So some treatment options. There isn't a medication that cures this because it is the valve that there's an issue with, so it usually requires surgical intervention. So there are, however, some medications that can kind of slow the progression of it. So that patients can take during the watchful period or the waiting period before surgical intervention becomes involved. So statins can help because statin drugs assist patients with this disease by depleting the intracellular supply of cholesterol. So excessive cholesterol in the blood can cause an increased risk of aneurysms in patients with the bicuspid aortic valve disease. This happens when cholesterol congregates on the inner walls of the arteries, and this it blocks adequate blood flow and then causes an increased risk of pressure within the arteries themselves. So statins help again by depleting the intracellular supply of cholesterol. Aspirin is another drug that is an anticoagulant, so it helps thin the blood. The doctor may also prescribe ACE inhibitors, which can open the blood vessels more fully, beta blockers, which can slow the heart rate, diuretics, which lessen the amount of fluid in the body and ease stress on the heart. And then when symptoms start occurring and the aorta diameter is changing, that's when surgical intervention becomes a priority. So surgical interventions, or surgical intervention comes into play when an asymptomatic patient begins to manifest signs and symptoms due to progressive narrowing and stiffening of the aortic valve. So the only effective therapy is surgical replacement of the valve at this point. So there are a couple of procedures here. There is open heart surgery, which requires a sternotomy, but there's also the gold standard treatment option, which is transcatheter aortic valve replacement. So this is a minimally invasive procedure that repairs the valve without removing the old damaged valve. So it wedges a replacement valve into the aortic valve's place. This is done by using a transfemoral approach, which we enter through the femoral artery, and it's performed with a small incision in the chest and entering through a large artery in the chest or through the top of the left ventricle. So some genetics, environment, and lifestyle things with this disease, the doctor will probably encourage the patient to make changes to improve their overall health. So these shifts might include tweaking their diet to make it a healthier diet for them, working on weight loss if it's needed, quitting smoking, of course, managing their stress, and then exercising depending on the symptoms. Usually these suggestions happen during the watchful waiting period before symptoms usually occur and before surgical intervention is called for. That is the end of my presentation. Thank you so much and have a great day.